Okay, we're from B10 and this is our presentation about TB in child. Okay, these are our members and this is the chapter 1 introduction. Okay, so tuberculosis is caused by Mycobacterium tuberculosis and it can manifest as both extrapulmonary and intrapulmonary tuberculosis. It can have these identifiable pathological structures called granulomas, and granulomas are a product of the immune reaction to the bacteria. And in TB, it's more prominent in children due to the immature immune state of the children. In common age for pediatric TB is between 5 and 14 years old, and in 2021, about 1.1 million children and adolescents has TB, and about 226,000 are proclaimed dead. And pediatric TB prevalence is tightly related to the community's active TB prevalence and also the low socioeconomic status of the child. Thank you. Okay, so these are the problem formulations and the purpose of our paper. Chapter 2, Literature Review.
Okay, greetings. My name is Krisnaditya Dwi Raharja with the last digit of student ID number 014. Today I will explain about definition of tuberculosis. So tuberculosis is a contagious infectious disease caused by the bacterium Mycobacterium tuberculosis, which is slow growing and difficult to identify in sputum and tissue samples, primarily affecting the lungs, but can also affect other organs such as the kidneys, bones, and brain. Most cases of TB in children are caused by contact with an adult family member suffering from pulmonary TB, and the tuberculosis can present in two forms: active TB, which is symptomatic and contagious, and latent TB, asymptomatic but can be reactivated. Okay, that's all from me. Thank you, and next slide.
Hello everyone, my name is Sara, Putri, Bungaran, with 078 as the last 2 digits of my student number, and this time I'm going to explain about the epidemiology of TB in child. Approximately half of the world's population is infected with TB, including 67 million children under the age of 15. The burden of pediatric TB varies significantly by country and region, with the African region experiencing a 30% incidence rate and the Southeast Asian region experiencing a 48% incidence rate. Childhood TB mortality remains a significant public health issue. By 2022, it is projected that 1.25 million children will have developed TB, resulting in 214,000 deaths from these preventable and curable diseases, representing 17% of all TB-related deaths. Of these deaths, 80% will be among children under the age of 5, and 96% will be among children who have never received TB treatment. Children without tuberculosis preventive treatment have a 5 to 10% risk of developing TB disease. For children younger than 2 years, the risk of progression from latent infection to tick disease is not significant within the first year after exposure, often occurring without prior notable symptoms. In contrast, children aged 2 to 10 years exhibit a lower risk, typically presents with symptoms such as of TB when they do develop the disease. Maybe that's all for me. Next will be continued by my colleague. Thank you.
Let me introduce myself. I am Muhamad Hudaya with the last 3 digits of student register number 093. TB in children is caused by Mycobacterium tuberculosis, the same bacterium responsible for adult TB. It's a rod-shaped, aerobic, and acid-resistant due to its lipid-rich shell wall, making it tough against the immune system and drug. The bacteria spread via airborne droplet from coughing, sneezing, or talking, particularly affecting children. Its attack of alveolar macrophage then spread to the other immune cell. Several risk factors contribute to TB in children, such as internal factors that promote active TB development and external factors like exposure to infection, socioeconomic condition, poor nutrition, close contact with TB patients, especially in crowded and humid environment, significantly increase the risk of the infection. Children under 5 years are particularly vulnerable due to weaker immune system, and the symptom can be often mistaken for malnutrition for children under nutrition. Thank you.
Hello, my name is Wildan Mahsyar and my last name number is 174. So about the pathophysiology. First one is entry of Mycobacterium tuberculosis. Droplets containing MTP can enter the respiratory tract through inhalation, and then the MTP can escape the defense system, which consists of mucociliary and immune cells in the lamina propria, and then the immune reaction occurs. The macrophages and neutrophils phagocytose MTP in alveoli. But MTP can inhibit cytotoxicity of macrophages, so the replication of the bacteria can continue and even lead to the lysis of macrophages. And then the release of cytokines and dendritic cells will migrate to the lymph nodes to present the antigens. And then the adaptive immunity occurs by the differentiation of T cells in aim to further eradication of MTP. And then the accumulation of immune cells and epithelioid form granulomas. Then the lymphatic and hematogenous spread. The primary complex can be a source of the spread of tubercle bacilli, and it can cause the complications such as TB meningitis and miliary TB.
So the next one is signs and symptoms of TB in child. My name is Nethania with the last 3 digits of student number 112. For primary infection, children will have fever, prolonged cough, a weight loss and failure to thrive, and the rest is mentioned in the slide. In pulmonary TB, extrapulmonary manifestation including lymph nodes, abdominal bone, joint, and CNS disease that can manifest with altered mental status, cranial nerve palsy, headache, vomiting, or seizure. In spinal TB, children will have gibbous deformity, and in miliary TB, children will have high fever, GI symptoms, hepatosplenomegaly, dyspnea, cyanosis, and respiratory distress with diffuse greenish spots on the chest X-ray. That's all from me. Thank you.
Hello, my name is Pramesthie with the last 3 digits number 208. So now I'm going to explain about the diagnosis of TB in child. The diagnosis of pulmonary tuberculosis in children is complicated since childhood TB is paucibacillary. Symptoms are ambiguous, and in the early stages of disease, up to 50% of children can be asymptomatic. Conducting a thorough medical history, including information about previous TB treatment, BCG vaccination, and tuberculosis symptoms, it is also necessary to assess nutritional status and risk factor for tuberculosis infection and illness, such as young age, HIV infection, recent measles history, and the presence of other immunocompromising disorders or immunosuppressive medication. The WHO approved a respiratory specimen for diagnosing tuberculosis in children are spontaneously expectorated sputum, induced sputum, gastric aspirates, nasopharyngeal aspirates, and also stool, including the WHO-approved tuberculin skin test and the interferon gamma release assay determine the existence of an immunological response to tuberculin antigens. For the indication of the result, you guys can see on the slide. Chest X-ray are critical for diagnosing intrathoracic tuberculosis, the most frequent kind of tuberculosis in children, as they assist in visualizing abnormalities such as hilar and mediastinal lymphadenopathy. So that's all from me. Thank you.
My name is Nadya Ernestine, and the last three digits of my serial number are 155, and today I'm going to talk about the differential diagnosis of TB in child. So the first one is pneumonia, which is a condition wherein the air sacs in the lungs become inflamed and may fill with fluid or pus. It is often to be confused with TB due to their similar symptoms. TB can present like bacterial pneumonia or atypical pneumonia with a dry cough and other systemic signs. Research shows that TB can either cause severe pneumonia or increase the risk of secondary bacterial pneumonia. Pneumonia tests frequently miss TB, leading it to misdiagnosis. And then the second one is asthma. Asthma is a chronic inflammatory condition where there is shortness of breath, coughing, and wheezing. Both asthma and TB can present with chronic cough and wheezing, but the wheezing in TB is usually monophonic and caused by intraluminal obstruction. TB symptoms often resemble those of asthma, making misdiagnosis possible, and especially when the chest X-ray appears normal. So the key to differentiate TB with asthma is TB patients usually cough up thick mucus, localized wheezing, and lack of response to standard asthma treatments. And doctors should also be mindful that TB can also still develop during asthma treatment. Thank you.
Thank you for the time. My name is Harmonica with registration number 077. I'm going to continue with the differential diagnosis. Other differential diagnosis for TB in children include sarcoidosis, fungal infection, non-tuberculous mycobacterial infections or NTM, lung malignancy and lymphoma, and lung abscess. Sarcoidosis and TB are both granulomatous diseases, but TB has caseating granulomas. Lung infection, malignancies, and abscesses may mimic TB symptoms.
Hi, my name is Putri Urmila with last three digits of the number 201, and I will explain about the complications of tuberculosis in child. So, TB in child leads to both pulmonary and extrapulmonary complications due to the body's immune response and the bacteria's direct effects. Pulmonary complications include lymphadenopathy, where swollen lymph nodes in the chest restrict airways, cavity formation, where lungs tissues disintegrates, creating air-filled cavities that harbors bacteria. Bronchiectasis occurs when long-term inflammation damage airways, leading to mucus build-up and recurring infections. Pleural disease causes platelet or pus accumulations around the lungs, and progressive lung parenchymal injury that may result in irreversible damage if untreated. And then the extrapulmonary complications include hematological change like leukopenia and anemia, cachexia with severe weight loss and muscle wasting, erythema nodules which cause painful red skin nodules, miliary TB, a severe form of the disease affecting multiple organs, and TB meningitis that can cause brain inflammation leading to motor and cognitive abnormalities. So that's all about the complications of TB in child. Thank you.
Hello, my name is Sifa'ul with 073 as the last digit of my serial number. So this time I will explain about the prevention of tuberculosis or TB in children. So there are many to prevention that can be done. The first one is vaccination. So vaccination is very important as it can give protection to TB infection in children. And the vaccine that is used is called BCG vaccine, which is given to newborn neonates. Okay, the second one is TB preventive treatment or TPT. This type of prevention is different from vaccination. So TPT consists of drugs regimen that is given to children with the most risk, such as living with HIV or living with people with bacteriologically confirmed TB. So the purpose of TPT is to prevent the progression from TB infection into active TB. I think that's all from me. The next one will be explained by my colleague. Thank you.
Okay, thank you for the opportunity. My name is Dinaria Sakura Kirani with the last three digits of my student number is 055, and I will present to you the management of tuberculosis in children. For latent tuberculosis, rifampicin-based regimens are preferred due to higher treatment completion rates and decreased hepatotoxicity. It includes 3 months of once weekly isoniazid plus rifampicin, 4 months of daily rifampicin, and 3 months of daily isoniazid plus rifampicin. And for tuberculosis infections, the treatment is occurs at least 6 months using 2 months initiation phase that includes rifampicin, isoniazid, pyrazimide with or without ethambutol, and also 4 months of continuation phase using rifampicin and isoniazid. Therapy can be extended beyond 6 months with certain form of tuberculosis, poor response to therapy with cavitations and persistently positive smear at 2 months, or if there is poor adherence. That's all from me. The presentations will be continued by Murna. Thank you.
Chapter 3, Conclusion and Advice. TB is a contagious infection disease caused by Mycobacterium tuberculosis that transmitted through droplets. TB can present in 2 forms, active TB and latent TB. Active TB is symptomatic and contagious. Clinical sign and symptoms for TB in children is often a primary infection and may be gradual or acute onset. It includes fever, prolonged cough, weight loss, and failure to thrive. Children are more likely to have extrapulmonary manifestation and more complicated. Clinicians can examine through medical history, respiratory specimen assessment, TST, interferon gamma release assay, and chest radiography. There are 2 ways to prevent TB in children, which is vaccination and TPT or tuberculosis preventive treatment. Rifampicin-based treatment regimens are now preferred regimens for latent TB treatment. First-line TB treatment includes rifampicin, isoniazid, pyrazinamide, and with or without ethambutol, or RHZE. Because TB is very contagious infection, prevention such as vaccination should be done, especially in children. TB in children can be dormant and do reactivation when the immunity of an individual is not adequate. Patient compliance to take the medicines also should be monitored to achieve expected result and reduce virus reactivation in the future. That is all from us about TB in children. Thank you for your attention.